Hello everyone, I hope you all doing well. In the previous videos, we discussed about the pharmacokinetics and its first two step, that was absorption and distribution. Today we move towards the third step, that is metabolism, in which drug becomes pharmacologically inactive, less lipid soluble and easily excretable. And how we can define it can be defined as a change of chemical structure of drug from one form to another which is ready for excretion, right? Again, listen, it's the change of chemical structure of a drug from one form to another which is ready for excretion. Here we can take an example of ethanol, which act as CNS depressant, and change to acetaldehyde, which is ready for excretion. It may be also defined in an other words that uh, metabolism, in which the lipophilic drugs are changed to more water soluble or polar compounds which are ready for excretion. We use an other words for metabolism, that is biotransformation. Biotransformation means that the conversion of the drug into byproducts or metabolites. When the drug is metabolized, its capacity of the pharmacological activity is diminished. In short, the process of metabolism converts the drug into more polar form, which is pharmacologically inactive, less lipid soluble, and easily excretable. The net effect of metabolism is the inactivation of drug, but some drugs are converted into active form if the metabolite is active. Further biotransformation or excretion in the urine terminates its activity. Right? Here we have some examples of active drugs which become active metabolites after the metabolism. We take example of phenylbutazone, that converts into oxyphenbutazone, codeine into morphine, amitriptyline into nortriptyline, diazepam into dimethyl diazepam. Here we have an example some, and now we talk about some of the prodrugs, which means that these are the drugs which have no activity in vitro but activated by enzyme to produce new compounds which are active in vivo, right? We have an example of prednisone, that is converted into prednisolone, levodopa, that is converted into dopamine, Pecampicillin, that is converted into ampicillin, and phenacetin, that is converted into paracetamol. Here we have an example of some products which are converted into active metabolites after the metabolism or biotransformation. And here we some example of some drugs which are converted into toxic metabolites after the metabolism. These are isoniazid, that is converted into acyl hydrazine or acetylhydrazine. Few people pronounce it as acetyl, or few as acyl. So I pronounce it as acyl hydrazine. Halothane is converted into trifluoroacetic acid. And next we have an example of sulfonamides, which are converted into acyl derivatives, right? These are all examples of the drugs which are converted into toxic metabolites after the biotransformation of the drugs. Now we discuss about the sites of metabolism, where the metabolism process occurs and what organs, what tissue are involved in the metabolism of the drugs. Here we name some like liver, kidney, blood, intestinal epithelial cells, lungs, skin, etc. Metabolism takes place in all our body except dead tissue, right? Again, metabolism occur in all over the body except in dead tissue, right? Which organ is majorly involved in the metabolism? That is liver, because of microsomal enzymes are present in the liver, which are responsible for metabolism of various drugs into metabolites. Enzyme, we take the names like esterases, amidases, dehydrogenases, transferases, as well as P450 are responsible for the metabolism of the drug, right? And we should also keep in mind that metabolism can also be takes place into the mitochondria and plasma membrane, right? Here we concluded. Next we have types of metabolic reaction. What are the types, how many types, we discuss one by one. And today we just discuss only phase one. It has two phase, that is phase one, phase two. today we will discuss only phase 1, in which it includes oxidation reaction, reduction reaction, and hydrolysis. uh, and oxidation reactions are further divided into microsomal and non-microsomal. One by one I will tell you in detail. Let's start with oxidation reaction. What is oxidation? Oxidation means addition of oxygen or removal of hydrogen from the drug molecule. It may be microsomal oxidation, which takes place in the liver, and non-microsomal oxidation, which takes place in other parts of the body, such as mitochondria, urinary tract, etc. Microsomal oxidation takes place in the smooth endoplasmic reticulum of the liver. Liver contains membrane associated enzymes which are responsible for drug metabolism. The primary component of this enzyme system are cytochrome P450, which are responsible for oxidation reaction. Right. Now we have some types of oxidation reactions, which includes aliphatic hydroxylation, aromatic hydroxylation, and deamination. What happens in aliphatic hydroxylation? It involves the addition of hydroxyl group to an aliphatic group, for example meprobamate, which act as tranquilizer. It is oxidized to inactive hydroxymeprobamate, which is ready for excretion. What happens? Meprobamate, we have drug hydroxylation occur, it convert into hydroxy meprobamate, right, which is inactive form. Meprobamate, which act as hypnotic agent and is oxidized into ethyl methyl butyl barbituric acid. What happens? That phenobarbital is converted into ethyl methyl butyl barbituric acid. Right. Next we have aromatic hydroxylation. What happens in it? It involves the addition of hydroxyl group to an aromatic drug, for example phenacetin, analgesic antipyretic agent, is oxidized to acetaminophen or paracetamol, which is ready for excretion. What happens in aromatic hydroxylation? That phenacetin hydroxylized and converted into paracetamol. Similarly, we have example of anti-epileptic agent and chlorpromazine are oxidized into their metabolites, that is phenytoin into hydroxyphenytoin. Chlorpromazine is converted into chlorpromazine sulfoxide, right? And next we move towards deamination. It what is mean by deamination? It means the removal of amine group, yeah, amino group from the drug. For example amphetamine, which act as CNS stimulate, it is also called student drug, is converted into phenylacetone. Amphetamine after deamination converted into phenylacetone. Another example is benzylamine, is converted into benzaldehyde. And we have next we move towards the non-microsomal oxidation. What happen in it? It takes place in other parts of the body. Soluble enzyme in the mitochondria of the cells can metabolize few drugs like xanthine oxidase, oxidize xanthine to uric acid. Ethanol is oxidized to acetaldehyde by alcohol dehydrogenase. Methyl alcohol is oxidized to toxic formic acid and formaldehyde. Tyrosine is converted into DOPA by tyrosine hydroxylase. Here, these are the examples of some drugs which are converted into their the second form after the metabolism, or we can say after the oxidation. Next we move towards the reduction reaction. It involves the reduction of halogenated and nitrated compounds, right? Mostly these reactions takes place in the liver, for example nitrobenzene into aniline, nitrazepam into aminazepam. Similarly chloramphenicol and halothane are reduced to their metabolites It may be non-microsomal. For example, chloral hydrate is reduced to trichloroethanol, right? What we take the examples? We take the example of chloral hydrate is converted into trichloroethanol by reduction reaction, right? Next we move towards the hydrolysis. If we define hydrolysis, these are the reaction which takes place in the liver and are carried out by enzyme. These are esterases and amidases, which hydrolyze the ester and amide group of the drug. For example, aspirin is hydrolyzed by esterase enzyme into salicylic acid. Similarly, we have an example of procainamide is hydrolyzed into para-aminobenzoic acid, which is known as PABA, PABA, that is anti-fibrillatory agent, yeah, cardiodepressant agent. Next we have the following drugs which are hydrolyzed by hydrolysis in the liver. First we have example of pethidine, which act as narcotic analgesic. Second we have procainamide, which act as local anesthetic agent. Third we have acetylcholine, that is neurotransmitter. Atropine, which act as anticholinergic agent. Diacylmorphine or diacetylmorphine, which act as narcotic analgesic agent. Phenytoin, which act as anti-epileptic agent. We have some examples of the drugs which are hydrolyzed by non-microsomal enzymes. For example, hexamine is hydrolyzed to formaldehyde in the urinary tract system. Hexamine, which is act as urinary antiseptic. So these are the examples. Here these are the drugs which are converted into their metabolic form or in the biotrans form. Next we move towards the second phase, that is phase 2 reaction, and it involves different steps. We will discuss in detail in the second video or in the next video. I hope you like it. Like, subscribe my channel, don't forget to share. Thank you.